Welcome to Family Vlogs, and I would like you to watch this video now till the end, as we are going to talk about rabies. In today's video, I enlighten you about dog bites and rabies. Remember, rabies is one of the neglected tropical diseases. Stay tuned with me as we are going to start straight away by definition of rabies. Kindly subscribe. Rabies, by definition, is a viral zoonotic disease, meaning transmission of this disease is from an animal to human being, and it causes inflammation of the brain in human being and other mammals. It can be prevented by vaccination. Transmission of rabies infection is through the bite and scratch from an infected animal with rabies. In rare cases, rabies can be spread when infected saliva get into an open wound or the mucous membranes such as the mouth or eyes. This could occur if an infected animal were to lick an open wound. And dogs are the main source of human rabies, and 99% are of domestic dogs. As you can see some of the diagrams that we have enlightened here. 40% of suspected rabies bites are children under the age of 15 years. Now, other animals transmitting rabies are bats, cats, coyotes, foxes, skunks, raccoons, wolves, and mongoose. Livestock, e.g. cattle, sheep, and goats can also transmit rabies if they have been bitten by the above animal mentioned above. Signs and symptoms of rabies. Incubation period is between 2 to 3 months up to 1 year, and this will depend on these factors: location of the virus entry, i.e. how far from the brain, or viral load. Viral load is very important to know. Now, if you continue with the signs and symptoms of rabies, we have fever, headache, general body tiredness, loss of appetite, vomiting, pain or numbness or tingling sensation at the wound or scratch. This is stage 1, and symptoms are always vague. In stage 2, we have photophobia, that's fear of light, hydrophobia, fear of water, drooling of saliva, difficulty in swallowing, delirium, fear and hallucination, muscle spasm, and paralysis or aerophobia, fear of fresh air. And also stiffness of the neck and convulsions can set in. Forms of rabies, we have furious rabies, and furious rabies result into signs of hyperactivity, excitable behavior, hydrophobia, fear of water, and sometimes aerophobia, that is fear of draft or fresh air. Death occurs after a very few days due to cardiorespiratory arrest. Now, paralytic rabies, this is a form of rabies and takes longer to set in, but the effects are just as severe. Infected people slowly becomes paralyzed, will eventually slip into coma and die. The causes of death can be blockage of airways, seizures, exhaustion, or widespread paralysis. Signs and symptoms of rabid dogs. How can you know that your dog is rabid? A lethargic dog, usually tired and having low energy, fever, vomiting, excessive drooling of saliva, secondary to paralysis of the throat, associated with difficulty in swallowing and unable to drink or eat. Hypersensitivity, photophobia, sound and touch. This result into seizures. Dog may develop odd behavior like unchecked aggression, barking or snapping at nothing. Self-mutilation, e.g. non-stop gnawing at infected wound, and paralysis and lack of coordination. Pica, this is chewing stones and earth and rubbish. Management and prevention of rabies. First of all, elimination of rabies in dogs by vaccination. 2. Awareness on rabies and prevention of dog bites. Note that there are categories of how rabies post-exposure prophylaxis are being administered as form of management of rabies. So post-exposure prophylaxis: wash wounds with water, soap for 15 minutes, and local treatment with iodine, povidone to remove and kill the virus. Doses and administration. These are shown as you can see them above, and we are requesting that if you have never subscribed to this channel, kindly hit the red button written subscribe and turn on notification bell for more videos that we'll post. Thank you.